Hey everyone, and welcome to another deep dive. Today we're tackling American healthcare and specifically how to modernize the whole system. Congress is trying to figure it out, and we've got some pretty interesting sources to help us break it all
We
down.
got snippets from a congressional hearing even.
Yeah, we've got expert testimonies and even some public opinions.
Public opinions, yeah.
It's a lot to unpack.
Yeah, it
But
is.
it's important stuff. We're talking about a $37 trillion national debt, right? Small businesses are getting slammed with like a 50% drop in healthcare coverage since 2014. And so many people just put off going to the doctor until it becomes a crazy expensive emergency.
It really underscores the urgency of the situation. We're talking about millions of Americans, and their well-being. And the decisions being made today are going to have a huge ripple effect for years to come.
Yeah, it's people's lives, not just numbers on a spreadsheet. So let's dive into the goals here. Congress says they want to make healthcare more affordable and accessible for everyone.
Sounds good.
Yeah, it does sound good in theory, but is everyone really on the same page?
That's the question, isn't it?
Yeah, because get this, 80% of Americans think the government isn't spending enough on healthcare, but then you have some politicians who actually want to cut programs like Medicaid.
It's pretty fascinating to see these different perspectives clash.
Yeah.
You've got some folks who are really championing prevention and early detection,
Right.
catching those health issues before they become major problems. And then you have others who are just laser focused on cutting costs and streamlining programs.
So how does they actually play out in the real world? What does that look like?
Well, let's take lung cancer screening as an example. It's got the potential to save so many lives,
Yeah.
but only a small percentage of people who are eligible for it actually get screened.
Why is that? I mean, it seems like a no-brainer to get screened if you're eligible.
Well, that's one of the big questions we're going to be exploring throughout this deep dive. There are a lot of factors at play here, things like awareness,
Right.
access, and even just plain old fear.
Fear. Okay, so let's unpack that preventative healthcare angle a bit more. It seems like if we could shift from reacting to health problems to actually preventing them in the first place, that would be huge.
You're absolutely right.
Yeah.
And there are some really inspiring examples of preventative care in action. Have you heard of Mercy's program?
Mercy's program. No.
They're using genomic testing and AI to detect diseases like cancer super early on.
Genomic testing? That sounds pretty high tech.
It is high tech.
Wow.
It's like having a crystal ball for your health. So Mercy is really focusing on identifying patients who have a high risk of hereditary cancer. And they found that if someone has certain genetic mutations, their close relatives have a 50% chance of inheriting those mutations too.
So one person's health issue can potentially impact their entire family.
Exactly. And that's why this preventative approach is so powerful. Just imagine knowing your genetic risks and being able to take steps to prevent those diseases.
That's the potential of precision medicine, right?
Yes, exactly.
It's mind-blowing.
It,
But what about the people who are already struggling to afford healthcare today? What about small businesses?
Yeah, that's a critical part of this conversation. Small businesses are facing a real uphill battle when it comes to offering health benefits. Back in 2000, almost half of small businesses offered healthcare coverage. Today, it's only 30%.
Wow, that's a huge drop. Why is that happening?
Well, you have to remember that small businesses are the backbone of our economy. They create jobs, they drive innovation,
Right.
and they contribute significantly to our GDP. But the rising cost of healthcare makes it so hard for them to compete with larger companies.
Who can offer those, like, bigger, more comprehensive plans?
Exactly.
Yeah.
But there are some innovative solutions emerging. Things like health reimbursement arrangements.
HRAs.
Yes, HRAs. They give small business owners more control over how they offer healthcare benefits. And it gives their employees more choice as well.
So it's about flexibility and choice. What makes these HRAs so attractive to small businesses?
One big factor is cost control. With traditional group health insurance plans, the employer is kind of stuck with a set premium rate, whether their employees use a lot of healthcare or not.
Right.
But with HRAs, the employer sets a defined amount of money
Okay.
that they'll contribute towards each employee's healthcare expenses. So it gives them more predictability.
And they can control their costs a bit more.
Precisely.
That makes a lot of sense, especially for businesses with limited resources.
Yeah.
It sounds like HRAs could be a real game changer. But let's be real for a second. Health is about way more than just going to the doctor and having insurance, right?
You're hitting on a really important point. True health goes beyond those traditional healthcare solutions.
Yeah.
It's about having a holistic approach.
Holistic.
Yeah. One that ensures nutrition, lifestyle choices, and preventative measures.
So empowering people who really take control of their own well-being.
Absolutely. And you know what? There are some unexpected players stepping up to champion this holistic approach. Believe it or not, the life insurance industry is getting involved.
Wait, really? Life insurance?
Yeah. Think about it. Life insurance companies, they have a vested interest in longer lifespans, right?
Well, yeah, I guess so.
Healthier people, they live longer, which means they pay premiums for a longer period of time.
Makes sense.
It's a win-win for everyone.
Yeah, so they're not just paying out when someone dies, they're actually actively helping people live longer, healthier lives.
Exactly. And there are real-world examples of this in action. Some life insurance companies are offering discounts on premiums for things like gym memberships,
Wow.
healthy eating programs, and even just for tracking your steps.
They're basically incentivizing people to take care of themselves.
Exactly.
It's brilliant.
And it's not just life insurance companies. We're seeing businesses invest in their employees' health in new and innovative ways. Like there's this one company that decided to prioritize their employees' nutrition.
Oh, yeah, I read about that.
Instead of just offering the typical vending machine fare, they went all out with nutritional counseling. They had healthy meal options in the cafeteria, and they even offered cooking classes.
I bet the employees were thrilled.
They were.
Did it actually make a difference?
It did. Not only did employees love it, but the company saw improvements in their overall health. Fewer sick days, lower healthcare costs in the long run.
It was a win-win for everyone.
Exactly.
So investing in preventative health can actually boost a company's bottom line. Who knew?
It's a concept that's really gaining traction.
Yeah.
More and more businesses are realizing that a healthier workforce is a more productive and more engaged workforce.
This is also fascinating. It feels like we're at this crossroads in healthcare. We've got these powerful new technologies, a growing understanding of preventative health, and businesses are starting to prioritize employee well-being.
Yeah.
But we're also facing these really serious challenges like rising costs
Yes.
and an uneven playing field for small businesses.
You've summed it up perfectly. We are at a pivotal moment, and the decisions that we make today are going to determine the shape of healthcare for generations to come.
Okay, so we've talked about these big goals of making healthcare more affordable and accessible.
Right.
But it seems like there's so much debate about how to actually achieve that. And preventative care keeps coming up as a potential solution.
It does.
But what about technology? What role does technology play in all of this?
Technology, it's both a blessing and a curse when it comes to healthcare.
How so?
Well, it holds incredible promise for improving access and quality and efficiency of care, but it also has this potential to make existing inequalities even worse.
It's a double-edged sword.
Exactly. So on the one hand, we've got amazing advancements like telemedicine that allows people in rural areas to consult with specialists without having to travel long distances.
Right.
And then we have things like home dialysis, which can really improve quality of life for patients with kidney failure.
Those sound like amazing breakthroughs.
They are.
But what about the downsides? You mentioned those.
Yeah, well, the biggest concern is this digital divide.
The digital divide.
Yeah. If we're not careful, technology could create a two-tiered healthcare system where the people who have access to broadband and are tech-savvy and have all the latest gadgets,
Right.
they have a huge advantage over those who don't.
It's not just about developing new technologies. It's about making sure everyone has access to them.
Exactly. We need to be really mindful of the potential consequences of technological advancement and really work to ensure that everyone benefits.
It's a complex issue for sure. And speaking of complex issues, we can't ignore the elephant in the room, the role of government in healthcare.
Ah, yes. The perennial debate, how much should the government be involved?
It seems like people have some pretty strong opinions on both sides of that issue.
You're telling me our sources reveal a pretty stark contrast in viewpoints.
Yeah.
Some people advocate for increased government funding for programs like Medicaid
Right.
and the National Institutes of Health. They argue that these programs are essential for public health and medical innovation. Others are pushing for big cuts, claiming that government involvement just leads to inefficiency, overreach, and wasteful spending.
It's a classic ideological battle.
Yeah, it is.
But there's also this whole issue of transparency and access to information, right?
Absolutely. And this is where things get really interesting. During the Trump administration, there was this concerning trend of removing vital health information from government websites.
Seriously.
Yeah, this included information from the Office of Research on Women's Health.
Why would they do that?
Well, it's a question that raises concerns about transparency and public trust. When accurate, unbiased health information is suppressed or removed, it makes it much harder for people to make informed decisions about their health care.
Yeah, that's alarming.
And it can have a disproportionate impact on vulnerable populations who really rely on government resources for health information.
It seems like access to accurate information should be a fundamental right, especially when it comes to healthcare.
I couldn't agree more. Informed decision-making is crucial for a healthy society.
So we've got these competing viewpoints on the role of government, concerns about transparency, and this growing awareness of the importance of preventative health.
Yes.
With all this complexity, is there any hope for finding common ground on how to actually move forward with healthcare in America?
That's the million-dollar question, isn't it? The good news is that there seems to be at least some bipartisan consensus on one thing, the importance of addressing chronic diseases.
Like heart disease and diabetes and cancer.
Exactly.
Okay, that's a good starting point, but where do we go from there?
Well, the disagreements usually come up when we start talking about the best strategies to tackle these chronic diseases.
Right.
But even within those disagreements, there's potential for compromise and collaboration. One interesting proposal that's gaining traction is the FIT Act, which stands for the Personal Health Investment Today Act.
What's that all about?
It's a pretty bold idea.
Okay.
It suggests using tax-preferred savings for physical activity expenses.
So like using pre-tax dollars to pay for your gym membership or a yoga class.
Exactly.
Hold on. So you're saying the government could actually incentivize people to exercise?
That's the idea. The idea is to recognize that exercise is medicine
Mm-hmm.
and encourage people to invest in their physical well-being.
Interesting.
It's a proactive approach that could have a huge impact on public health.
And ultimately on healthcare costs.
Exactly.
I'm starting to see a pattern here. It seems like prevention is like the key word in this whole healthcare conversation.
It is a key word.
But prevention is just one piece of the puzzle, right?
You're right. We can't just keep throwing money at the problem and hoping for the best.
Right.
We need to fundamentally shift our thinking. We need to move away from this reactive system that focuses on just treating illness and towards a more proactive system that really prioritizes prevention and long-term health outcomes.
So it's not just about how much we spend on healthcare, it's about how we spend it.
Precisely, we need to invest wisely, focusing on strategies that have been proven to work.
Like preventative care,
Yes.
early detection,
Uh-huh.
and innovative solutions that address the underlying causes of illness.
You've got it.
It sounds like we need a whole new approach to healthcare, one that's more holistic, more preventative, and more focused on empowering people to take control of their own health.
You've hit the nail on the head. That's exactly the kind of paradigm shift we need to see. When we talk about a holistic approach to healthcare, what we're really talking about is considering all the factors that contribute to a person's overall well-being.
Okay, so it's not just about treating physical symptoms, it's about looking at the whole person.
Exactly. And that includes understanding the social determinants of health.
Social determinants. I've heard that term before, but I'm not entirely sure what it means.
It refers to all the factors outside of medical care that can influence a person's health.
Uh-huh.
Things like their socioeconomic status, their education level, their access to healthy food, even the neighborhood they live in.
So you're saying that where you live and how much money you make can actually impact your health.
Absolutely. Research has shown that these social determinants can have a profound impact on health outcomes.
Wow.
For example, people living in poverty often lack access to quality health care, nutritious food, and safe housing.
Right.
This can lead to chronic stress, which has been linked to a whole host of health problems.
It's like a vicious cycle. Poverty can lead to poor health, and poor health can make it harder to escape poverty.
Exactly, and that's why a holistic approach to healthcare is so important. We need to address these social determinants if we want to create a truly healthy society.
It sounds like this requires a much broader perspective than just focusing on medical interventions.
You're right, it means thinking beyond the walls of the doctor's office and involving other sectors like community organizations, social services, and even urban planners.
So it's about recognizing that health is not just an individual responsibility, it's a shared responsibility.
Precisely, we need to create a culture of health that supports individual well-being at every level. And that brings us to the concept of public health.
Public health, isn't that just about things like vaccinations and disease outbreaks?
It's definitely part of it, but public health is much broader than that. It's about promoting healthy behaviors, preventing disease, and creating environments that support well-being for entire communities.
Can you give me some examples?
Sure, public health initiatives might include things like promoting access to healthy food options,
Okay.
creating safe spaces for physical activity, reducing exposure to environmental hazards, and providing education about healthy lifestyles.
So it's about taking a proactive approach to health at a community level.
Exactly. And it's a crucial part of creating a healthcare system that's truly focused on prevention.
This all sounds great in theory, but I can't help but wonder about the cost. All these initiatives must require a lot of funding.
You're right, investing in a robust public health infrastructure does require financial resources. But here's the thing, prevention is often much cheaper than treatment.
There's that word again, prevention. It really does seem like the key to a healthier future.
It is. And it's not just about saving money, it's about saving lives. Chronic diseases, like heart disease, diabetes, and cancer, are the leading causes of death and disability in the United States. And many of these diseases are preventable.
So we're talking about increasing lifespans and improving quality of life, not just lowering healthcare costs.
Exactly. And that brings us back to the role of innovation. We need to continue investing in research and development, exploring new technologies and treatments that can help us prevent and manage these chronic diseases.
We've already seen how technology can expand access to care and improve diagnosis. What other exciting innovations are on the horizon?
One area that holds immense promise is personalized medicine. This involves using an individual's genetic information to tailor treatments and prevention strategies.
So it's like custom-made healthcare.
In a sense, yes. By understanding a person's unique genetic makeup, we can predict their risk for certain diseases and develop interventions that are more likely to be effective.
That sounds incredible. It's likely on the cusp of a healthcare revolution.
It's certainly an exciting time to be involved in healthcare, but innovation alone is not enough. We need to ensure that these advancements are accessible and affordable to everyone.
Right. We don't want to create a system where only the wealthy can afford the latest and greatest treatments.
Absolutely. That's why it's so important to have a robust public health infrastructure that can support the widespread adoption of new technologies and therapies.
It's about finding a balance between cutting-edge innovation and equitable access.
You've got it. And that balance requires thoughtful policy decisions, strategic investments, and a commitment to putting the health and well-being of all Americans first.
So we've covered a lot of ground here, from social determinants and public health to preventative care and technological innovation. It's clear that there's no easy fix to the healthcare puzzle. It's a complex web of interconnected issues. But what about the political side of things? Is there any hope for finding common ground on this issue?
That's the million-dollar question, isn't it? The healthcare debate is often highly partisan, with each side entrenched in their ideological positions.
It feels like healthcare has become another battleground in the culture wars.
To some extent, yes, but I also believe there's more common ground than we might realize. Both sides agree that we need to address chronic diseases, improve access to care, and make healthcare more affordable.
It's like everyone agrees on the destination, but we can't agree on the best route to get there.
Exactly. And it's in that space of disagreement where the potential for compromise and collaboration lies. We need to move beyond the rhetoric and focus on finding practical solutions that can benefit all Americans.
It sounds like we need a new approach to healthcare policy, one that prioritizes pragmatism over ideology.
I couldn't agree more. We need leaders who are willing to listen to different perspectives, compromise on their positions, and work together to build a healthcare system that truly serves the needs of the people.
It's about finding solutions that are data-driven, evidence-based, and focused on improving health outcomes.
And it's about recognizing that healthcare is not just a policy issue, it's a human issue. It's about ensuring that everyone has the opportunity to live a long, healthy, and fulfilling life.
That's a powerful message. This deep dive has been incredibly insightful. I feel like I have a much better grasp on the complexities of the healthcare debate.
I'm glad to hear that. It's a complex issue, but it's one that deserves our attention and engagement. The future of healthcare in America depends on informed citizens like you who are willing to engage in thoughtful dialogue and advocate for meaningful change.
Absolutely. So what does this all mean for our listeners? What are the key takeaways they should be thinking about as they navigate this complex landscape?
I think the most important takeaway is that there's no easy fix.
Right.
The healthcare system is a complex web of interconnected issues, and finding solutions requires a multifaceted approach.
It's not just about choosing between left-wing and right-wing solutions. It's about crafting innovative and pragmatic solutions that address the unique challenges of our time.
Exactly, and that means engaging in informed dialogue, being willing to challenge our own assumptions, and seeking out diverse perspectives.
It's about recognizing that we're all in this together. We all have a stake in creating a healthcare system that works for everyone.
Precisely. And that shared responsibility requires us to be informed, engaged, and willing to advocate for the kind of healthcare future we want to see.
I love that: informed, engaged, and advocating for change. Those are powerful words. But before we wrap up this part of our deep dive, I want to touch on one more aspect of the healthcare debate that's often overlooked: mental health.
Ah, yes, mental health. A critical component of overall well-being, yet often stigmatized and underfunded.
Exactly. We can't talk about modernizing healthcare without addressing the mental health crisis in this country.
Absolutely. The prevalence of mental health conditions is on the rise, and the COVID-19 pandemic only exacerbated the problem.
We saw a surge in anxiety, depression, and substance abuse, and the strain on our mental health system became even more apparent.
And yet, access to mental health services remains a significant challenge for many Americans. There are long wait times for appointments, limited insurance coverage, and a shortage of qualified mental health professionals.
It's a system that's failing to meet the needs of millions of people.
And the consequences are devastating. Untreated mental health conditions can lead to a decline in physical health, strained relationships, lost productivity, and even suicide.
This is not just a personal tragedy, it's a public health crisis that demands our attention.
And that requires us to rethink the way we approach mental health. We need to integrate mental health services into primary care settings, increase funding for research and treatment, and reduce the stigma associated with seeking help.
It's about recognizing that mental health is just as important as physical health and deserves the same level of care and attention.
Precisely. And that means creating a culture that supports mental well-being, where people feel comfortable talking about their struggles and seeking help without shame.
It's about shifting our mindset from one of silence and stigma to one of openness and support.
And that shift requires a collective effort from individuals, communities, and policymakers.
So it's not just about increasing funding or expanding access to services. It's about changing the way we think and talk about mental health.
Exactly. We need to create a society where mental health is treated with the same urgency and compassion as physical health,
Where people feel empowered to seek help and supported in their recovery.
and where mental health is no longer seen as a weakness, but as a normal part of the human experience.
I love that normalizing the conversation around mental health is so important. It's about breaking down the barriers that prevent people from getting the help they need.
And it's about recognizing that we all have mental health, just as we all have physical health. It's a spectrum, and everyone's experience is different.
It's about creating a culture of empathy and understanding where we support each other through the ups and downs of life.
And where we prioritize mental well-being as a crucial component of a healthy and fulfilling life.
Well said. You know, this conversation has been incredibly enlightening. I feel like we've only just scratched the surface of this complex issue.
There's always more to explore, but I believe this deep dive has provided a solid foundation for understanding the challenges and opportunities facing healthcare in America.
We've covered a lot of ground, from preventative care and holistic health to technological innovation and the social determinants of health. We've even delved into the contentious political landscape and the often overlooked issue of mental health.
And throughout this exploration, we've emphasized the importance of informed dialogue, critical thinking, and a commitment to creating a healthcare system that serves the needs of all Americans.
So, as we wrap up this part of our deep dive, what's the one message you want to leave our listener with?
The future of healthcare is in our hands. We have the power to shape the system, to advocate for change, and to create a healthier future for ourselves and generations to come.
I love that. It's a call to action, an invitation to be part of the solution.
Precisely. And that solution requires us to be informed, engaged, and willing to challenge the status quo. It requires us to be compassionate, empathetic, and to prioritize the health and well-being of all Americans.
It's about moving beyond the political rhetoric and focusing on finding practical solutions that can improve the lives of millions of people.
And it's about remembering that healthcare is not just a policy issue, it's a human issue. It's about ensuring that everyone has the opportunity to live a long, healthy, and fulfilling life.
Beautifully said. This has been an incredible journey. I feel like I've learned so much, and I hope our listeners have too.
I'm confident they have. And I hope this deep dive has sparked their curiosity, inspired them to learn more, and empowered them to be part of the conversation.
Absolutely. The future of healthcare depends on all of us. So stay informed, stay engaged, and stay hopeful. There's a lot of work to be done, but together we can create a healthier future.
Well said. And remember, your health is your wealth. Invest in it wisely.
All right, so we're back for the final part of our deep dive into American healthcare, and, we can't really wrap things up without talking about the cost.
Yeah, that's the elephant in the room, isn't it? Prescription drugs, hospital bills, insurance premiums, it all adds up. And it's a major concern for a lot of people.
Yeah, I mean, it's definitely one of the main things driving those heated political debates that we talked about earlier.
For sure.
You've got one side saying that healthcare spending is totally out of control and we need to cut costs.
Right.
And then the other side arguing that we can't sacrifice quality of care or access.
It's a tough balancing act, no doubt. And to really find solutions, I think we need to take a closer look at the root causes of these sky-high healthcare costs.
Yeah, instead of just pointing fingers, we need to actually understand what's driving those costs up in the first place.
Exactly.
So what are some of the key factors that are contributing to this problem?
Well, one of the biggest culprits is the rising cost of prescription drugs.
Yeah, we've seen some insane price hikes in recent years.
Oh yeah, it's been astronomical.
And that's really putting a strain on both individuals and the healthcare system as a whole.
Absolutely.
So it's not just about the overall cost of healthcare, it's about the cost of these specific medications that people rely on.
Exactly.
What else is contributing to this problem?
Another major factor is administrative inefficiency.
Administrative inefficiency.
Yeah. The U.S. healthcare system is so complex. There are so many different payers and providers and regulations.
Right.
And all that complexity leads to a ton of paperwork and bureaucracy and overhead costs.
So we're basically paying for the complexity of the system itself.
In a way, yeah.
That's so frustrating. Anything else?
Yeah, there's also the fee-for-service payment model,
Okay.
which kind of incentivizes providers to order more tests and procedures.
Even if they're not necessary.
Even if they're not necessary.
Wow.
So the more they do, the more they get paid.
regardless of whether it's actually benefiting the patient.
Exactly.
It sounds like we're kind of trapped in this system that rewards quantity over quality.
You got it. And all of this, it contributes to this vicious cycle of rising cost and diminishing returns.
It's a pretty bleak picture, to be honest, but is there any way to actually break this cycle? Like, can we control these costs without having to sacrifice the quality of care?
I believe we can.
Okay,
There are some promising strategies that are being explored.
good.
One of the most important is increasing price transparency.
Price transparency.
Yes, for both prescription drugs and medical procedures.
So making it easier for people to understand how much things actually cost.
Exactly. When people have access to clear, upfront pricing information, they can make better decisions about their health care.
That makes a lot of sense. What else can we do?
Another important strategy is transitioning to value-based care models.
Value-based care, what does that mean?
It means rewarding providers for keeping patients healthy rather than just treating them when they're sick.
So shifting the focus from volume to value, from treating illness to promoting wellness.
Exactly. And it requires a fundamental change in the way we think about healthcare. We need to move away from this system that's primarily driven by profits and toward one that prioritizes patient outcomes.
So putting patients first and focusing on what really matters, their health and well-being.
Exactly. And that requires collaboration among everyone involved: patients, providers, payers, and policymakers. We all need to work together to create a system that is both financially sustainable and focused on delivering high-quality care.
Well, this has been an incredible deep dive into American healthcare. We've explored the challenges, the opportunities, the political battles, and the human stories behind all the headlines.
We really have.
And I think we've really highlighted the fact that, the future of healthcare, it's not predetermined. It's something that we create through our choices, our actions, and our collective will.
Well said.
So as we wrap up this final part of our deep dive, what's the one message you want to leave our listeners with?
I would say remember that healthcare is not a spectator sport.
Oh, I like that.
It's something that we all participate in, whether it's patients, providers, or policymakers.
We all have a role to play in shaping the system and advocating for the kind of healthcare future we want to see.
Exactly. So stay informed, stay engaged, and stay active in this conversation because the health of our nation really depends on it.
So well said. And on that note, we'll wrap up the deep dive into American healthcare. Thank you so much for joining us on this insightful journey.
It's been my pleasure. And remember, your health is your most valuable asset, so take good care of it.
Great advice. And until next time, stay curious, stay informed, and stay healthy. See you 2-8.